Hello, Taz. Testing. 1, 2, 3, 4.
Okay, here's number counter. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Seizure induction. I think Taste is getting ready to come up. She was waiting another minute on Libby. Yeah. I reckon she's coming. Typically, if she's coming, she'd be here. All right, we got Sean.
Are you going to do that thing about the that you sent me? What, the cancer killing cells?
Yeah, I was thinking about that. Yeah,
That's a good one.
Yeah, I think it's a revolutionary cancer vaccine.
Yeah, that one.
Yeah, okay, gotcha. Yeah.
What?
Lydia's an every other week.
Oh, she is? Is that what she just told you?
Yeah.
Oh, okay. Even on Saturday?
Yeah.
Okay.
Yeah, that would make sense. I think we can handle it. I think we can.
Huh?
Yes, he's being he's being kind.
All right.
What was that old Saturday Night Live skit where they listened to techno music?
Oh, yeah,
I
yeah.
remember when they would
Yeah,
dance.
they move their heads.
Yeah, that was funny.
Don't hurt me, don't hurt me, no more.
No more.
Almost ready.
Shannon needs to come over and have you sign charts.
Okay.
She retired yesterday. Place isn't hers anymore, so
What?
she sold it yesterday.
Okay. Okay.
Means I'll probably drink if she shows up. Dry January made it till January 7th.
That's good.
Yes, it's good.
I think for you, it's really good.
That's right. And if I do it tonight, doesn't mean I have to do it tomorrow night.
That's right. As Steve says,
What's that?
it's so long, not goodbye.
Yes.
I'm the same way.
Everything in moderation.
Everything in moderation. That's right. Just a little bit here, a little bit there.
Including moderation.
That's right. We're not expecting to stop something. Just temper. Tap the brakes. Tap the brakes.
It's not been hard, it's been easy. But Chanda is a different story.
She's a bad influence. I think.
Yeah.
I think she is. I think she is.
That's an understatement of the year.
All right, let's test microphones. Taste.
Hold on. Turn fucker on. Hello.
Okay. There you go. Okay. Let me do one quick thing and then we'll get ready. I'll let my drink.
I think you turned the air conditioner off prematurely.
No, I was like, I got a long sleeve shirt on in
Fuck.
here.
Son of a bitch. He turns the fucking air conditioner off and then leaves. Oh my God. What's wrong with him?
One thing, we've been concentrating on trying to air condition this up here. It was gonna cost like $5,000 to do it right.
No.
And well, if it's gonna be living space up here, we'd sell the house better if we did. But I was thinking the problem may just be insulation. So we just need to insulate this box better, and that would help a bunch.
It would help. Yeah. No, it would help. It would help. It would help. It would help.
All right, you guys ready?
Yeah, let's do it.
All right. We got to talk about Damar today. Somebody asked a question about it.
Okay. We can talk about it. Yeah, we can talk about it. I've got some other stories.
Right? You ready?
Mm-hmm.
Sirius XM. It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hey, Steve.
Hey.
And Scott.
Hey, what's up?
Well, this is a show for people who had never listened to a medical show on the radio. If you've got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347
Poohhead.
Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. And check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And I do want to announce the birthday of Mr. Cardiff Electric.
Stop. Stop it right now.
I just slipped that one by you there. Taste.
Almost.
I don't usually pay attention, but I caught that one.
Well, I'll try to slip it in later. I know. When I
was
see
dozing off.
Tacey on her phone, just wink at me, Scott, and I'll slip in the
She'll
birthday
never know.
announcement. Okay. So, we've got some things. We've got a question or two, obviously, about Damar Hamlin. I was supposed to be on Anthony and then on Gino Visconti's show and a couple other ones, and I just was so busy this week I didn't have an opportunity to talk about it. Well, we can just go ahead and get this out of the way now. I think that's the thing that people
Let's do
are
it.
really
Yep.
interested in. Let's see.
Hey, Dr. Steve, it's Matt Charleston.
Hey,
I'm
Matt.
calling to ask you about Damar Hamlin,
Yeah.
the Buffalo Bills player who was hit Monday Night Football game. Got up from the hit, stumbled, and then collapsed at
Yep.
cardiac arrest. Heard about this happening in other contact sports like hockey,
Sure.
and wondering if you can talk about that.
Yeah, absolutely. Thanks. We were going to talk about it anyway, but it's always nice to have a phone call.
Like
to
a real
spur it.
question.
Yeah, that's
A real
right. It's
question.
almost like a real radio show. Yeah. So when I saw it happen, I kind of knew well, I didn't know anything, but I had a real good idea that what had happened was a thing called commodio cordis. And that is so you've seen people, have you seen the movie The Abyss?
No.
Okay, so they do a code blue in the movie The Abyss, completely unrealistic, but a lot of people have seen that. You've got Ed Harris and Mary Elizabeth Mastrantonio over on one side in a submarine a mile down or some ridiculous amount.
Stop. It's enough.
And then they have to get from one submarine to the other,
Yeah.
but they only have one pressure suit.
Ugh.
So she says, just take me over there. I'll die, but then you can resuscitate me on the other side, which is a pretty cool plot point. Of course, she was the smart one. And so he does that, and you see her, halfway through, she's, underwater, and then she dies. When they get her up there, she's dead. But the thing that is apropos to this is he does a thing called a chest thump. Now, in movies, they pound on people's chests and, thong, 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 breathe, damn you, breathe. And then, the people goes, and coughs up water and stuff. But the chest thump itself, so that's fake. But the chest thump itself is real because the heart has the ability to, or one of the characteristics of the heart is that when you poke on it with the right sort of amplitude, you can generate an electrical impulse.
Gotcha.
It's almost like it's almost piezoelectric.
Right.
You have these crystals, and if you thump them, they make an electric current. So this is a different mechanism, but kind of the same thing. So the chest thump is a real thing.
Right.
And if you do it at the right amplitude at exactly the wrong time, what happens is you generate an impulse that cancels out the electrical current in the heart. Now you go, well, how in the hell could it do that? Well, let's talk about that just for a second. The top part of the heart, the atria, and the right atrium of the heart is a little thing called the
atrioventricular node.
Wait,
what a minute.
Oh,
Go ahead, give
Look
me
at
a bill
you.
right now. I'll
That's
take
right.
it. I'll take it.
We'll
Tasty.
take it. Yep.
One
Very
is
good.
it, baby.
Very good. You got one bail.
Yes.
And it's basically the pacemaker of the heart. So it will contract. It creates a current that flows from that node to a thing called the sinoatrial node.
Okay.
And no, wait a minute. The atrioventricular node. We were just talking about the sinoatrial node. So anyway, you've got this sinus node. It fires, and that contracts the top part of the heart. That's the lub, and then it sends this electrical signal to the atrioventricular node, which then has fibers that go all the way down around the bottom of the heart, and it starts to contract from the bottom up.
Right.
But the impulse goes from the top down. Now it's got to repolarize, which means that the current's got to go in the opposite direction to get the heart ready to do this again. So top part is lub, bottom part is dub. You hear the lub dub. Okay, right? So if you hit the heart in such a way that you generate an impulse going in the opposite direction of that impulse that's coming from the atrioventricular node to the ventricle. Okay, so you've got current going in one direction. Now you hit the person just at the right time, just at the wrong place. Right. And now you've got current going in the opposite direction. Those two currents will cancel each other out. And then the heart's just sitting there going, now what the fuck do I do?
Yeah.
It doesn't know what to do.
No. Out of sync completely.
And when that happens, you get a beat called, a rhythm called ventricular fibrillation. And ventricular fibrillation is where the heart is just sort of like, if you've ever seen one, it looks like a bag of worms. It's not contracting in any kind of functional way. And it's just jiggling like jello. And when that happens, now nothing happens. And there's no blood being pumped. And that is a so-called, pulseless cardiac arrest. And, we see this in hockey. See it in baseball.
Yes.
And it's always just a freak
freak
thing.
accident.
If it were really easy to induce, we'd see it all the time in baseball.
Right.
And not so much baseball. In football, we would see it all the time, and in rugby, and in to a lesser extent soccer.
Well, and even martial arts, mixed martial arts.
Sure, if you're
people
taken
getting
up,
kicked or punched in the chest,
because all of that would be outlawed if this was
right.
And
easily done. Yeah.
One thing I'm concerned about, and this is kind of off topic, is now that we've had. We should look at. Will you look up the incidence of commotio cordis on the football field? I just wonder how many other times this has happened.
I can tell you, I've only seen it in baseball. I've seen Little League baseball
Yeah.
players
Yep.
occasionally, and which is a terrible thing.
Yeah.
Because typically in a Little League setting, that happens, and the outcomes are really poor.
Well, and you don't have ambulances standing by.
Yeah, that's my point, yeah.
And all that stuff. You have to call 911. So one of the things that we look at when this happens is how quickly was circulation, artificial circulation started. So how quickly do you do CPR? And chest compressions have been shown to to push blood around enough that you can keep the brain alive, and because that's your goal. And then you want to get that heart rhythm back to normal as soon as you can. Could you find anything?
I can't spell it right.
Okay. Well, it's okay. Just
I spelled it so wrong that it says.
I don't know what that is.
Yeah.
Okay. It just incidents of cardiac arrest football. Just do that.
Well,
and just
that
see.
would have been.
Okay. Yeah, I said it wrong. Sorry.
Yeah.
So, anyway, so you want to to get to the person quickly, which they did with him, and get return of spontaneous circulation as quick as possible, which apparently they did. I think it took a couple of times, and but they did everything right. They put him in the ICU. I'm assuming that they did a hypothermic treatment because patients do better. There's some evidence that when this happens, you can preserve tissue better when the patient's body is cooled down. And we know that people that fall into cold lakes can be resuscitated after, 30 minutes of drowning, sometimes 45 if they're a kid. Yeah, Tace, what'd you find?
Okay, so this says this is a study, and it cited an estimate that sudden cardiac death incidents range from 1 to 40,000 to 1 in 80,000 athletes per year.
Okay, so how many athletes are there in the NFL? We should be able to figure this out.
yeah,
Well, just
a couple
ask.
thousand, yeah.
Echo, how many football players are there in the NFL?
There are 2,557 NFL active football players.
Okay, so there's, say, 2,000, and you said 1 in 80,000 per year?
Well, it's really stupid what it says because it said 1 in 40,000
Okay, it's 40 to
to
80,000.
1 in 80,000. So, I mean, I could have come up with that
Okay.
just
Yeah,
out of my
that's kind of
butt.
a wide range. Isn't
Yeah, a little bit.
it? Well, that just means that the numbers are so small that they can't give you a real accurate number. So let's say 1 in 60,000 then, right? So there's 2,000. And so what's that? It'd be 1 every 30 years was what we're looking at, right? Is that right? 1 in every 60,000 per year. And there's 2,000 players. Scott, right? Yeah,
Yeah.
nobody's looking
I'm
at
not
that.
doing
Yeah.
math. I'm
Okay,
not doing
that's
math.
fine.
I don't work
So we would
anymore.
expect a 1 every 30 to 60 years. That's why it's so infrequent. Yeah, go ahead.
So, did he die technically?
Well, I mean, okay, so that's a great damn question because how do we define death? In the old days, we used to define death as cessation of breathing. When you stop breathing, you were dead. And then what happened was we invented ventilators and mouth-to-mouth and stuff, and we learned that just stopping breathing doesn't mean you're dead. We just need to keep you breathing, so we put you on the ventilator. Then it was if your heart stopped, you're dead. We would declare people dead when their heart stopped. Well, then we developed CPR and the old chest thump. One of the things that could have brought him out of this, had they had nothing, was another chest thump.
Right.
That's the
Try to kick
interesting
it back
thing.
into
Yeah,
rhythm,
Yeah,
yeah.
just to kick it back into rhythm. Anyway, so we developed the advanced cardiac life support. When I say we, smarter people than I did, protocol, and people like Brian from BPS Radio / the Radio Freaks who do that every day, resuscitate people every day. The average survival when you have an 18-year-old, say, basketball player who has CPR is right around 17%. But it really that's average, and it has a lot to do, again, with how quickly you get on it. And when you've got a football player that's surrounded with medical personnel, you're in better shape if this happens. Yeah, Tace.
I did find some smaller numbers. It says, according to a 2016 study, and this is from BBC.com,
Okay.
there are approximately 100 to 150 sudden cardiac deaths each year during competitive sports in the U.S. alone.
So that would be what Scott was talking about: Little League, football,
All of
regular
it.
football, everything. Yeah.
Yeah, but I don't think that. I think I would like to see the incidence of the actual cardiac events due to the
thump.
thump. Yeah. Because most of them, are not.
Some of them are congenital heart
Most
disease.
of them have congenital heart disease, or they blow a clot or something like that. So it's a little different.
Give yourself a bill.
That's two.
Yeah, I'm up too, baby.
So
big,
anyway,
big difference. Though. Big difference
That's
in the
right,
different
that's
types of cardiac events.
and by the way, if you've got kids, don't blow off that physical exam, because that's where they catch
exactly right.
these things, and this stuff does happen where kids just get passed through, and then they end up in highly competitive high school or college sports and with a congenital heart illness that takes them out of this world. So
what's the youngest you've ever seen a heart attack or cardiac event in somebody?
oh boy, I don't know, pretty young.
Yeah,
Why, what do you think?
well, I was going to say I saw one when we were in Houston, and he was 16.
Oh my goodness.
Had just a normal MI. Had showed all the normal signs and symptoms, and everybody's like,
Yeah.
well, I mean, we saw him after.
Do they know what
after.
caused it?
It was congenital. Yeah, some kind
it
of
was,
rhythm defect.
okay.
But,
Because with the diet that kids eat these days, they have found some kids that have atherosclerosis of their
yeah.
hearts at very young ages. I worry a little bit about our kids on that because their diet is not as robust as I
terrible.
would like for it to be. But anyway, so they got to him quickly. Now, when you have someone in the ICU, you don't know if you sedate them and you put them on a hypothermic protocol and you cool them down and then you wait. And one of the things that we use to determine whether someone's going to do well is a thing called the Levy scale. And Levy took 1,000 people that came in with cardiac arrest and looked at lots of different criteria and then developed what we call a multivariate analysis of conditions or signs or symptoms that would lead to a bad outcome. And so you look at people at day 1, day 3, and day 7. And without going through the whole Levy protocol, and this isn't the Levy protocol we all know where you stop smoking for 3 days and then you start smoking again. That's a different Levy protocol. That's the Bob Levy protocol. But the most important criteria of this is if the patient is following commands on day 7, that's a very good indicator of excellent prognosis. There are a lot of indicators of bad prognosis.
Sure.
One of those being dysconjugate gaze. In other words, that they're not able to, their eyes are just sort of floating around.
Can't focus.
The roving conjugate gaze on the first day, you may have a good outcome with those. But this Damar was following commands and signaling and actually communicating on day 5, I think, day 4 or 5, I'm not sure. Obviously, I wasn't there. I'm just going by what I'm reading. So those are all really good signs for good outcome. It says here, just 4 days after his stunning on-field cardiac arrest, Buffalo Bills safety Damar Hamlin is breathing on his own and speaking to his family, physicians, and teammates. So, again, all signs of
he was 48 hours, couldn't talk, but was actually answering questions via writing and moving his hands and toes.
Yeah, well, he probably had to. He was probably in a tracheal.
He was intubated. Yeah,
he was intubated, so he had a tube going from the
ventilator.
outside to the inside of his lungs.
Yeah, I think they just took him off the ventilator on Friday.
I don't know.
Thursday.
I don't know. I wasn't there, so.
I saw it on the internet.
But anyway,
it's got to be right.
So, but that's how we look at these things. Is there are other there's blood tests that you can do. There's a serum neuron enolase, and you can do that, and it's a sign of bad outcome. If it's elevated, the problem with it is in our hospital, it takes 2 weeks to get back. So by then you already know. So what you're really looking at are clinical things like this. So the Levy scale is one you could just look at the patient, do a very simple physical exam, and you get a pretty good idea of what their outcome is going to be. So they would have done that, and that's good news. So good for him. I'm glad. And what I'm concerned about is the way that the NFL does things. They ignore some stuff and then they knee-jerk other things. And I'm afraid that they're going to, now require some sort of sternal protection or something like that for something that happens one time in 60 years.
Yeah.
But it is 100 people. Would you say 100, 150 days, something like that?
Yeah, I believe
Every
so.
year. I mean, we got a population of 350 million. The odds that that's going to happen to you are small, but still that's 100 tragedies. People just going out to play a sport and have some fun or make a living, and then the next thing you know, this happens. So, anywho, but that's what it was. I've heard people say, "Well, he got vaccinated." Well, okay, there's 2 people on that team that didn't get vaccinated. Let's not make this about the vaccine. At this point.
The article also spoke about that.
Oh, it did?
Yeah, just a little bit.
Well, what did it say?
Well, let me get my glasses
Okay, don't worry about it.
on.
It's okay.
Let me
Jeez.
pull it up.
If there was no if there was no sign of myocarditis in him ahead of time, then this didn't have anything.
Probably unrelated.
Yeah, and somebody sent me a graphic, and it basically said, look at all the different things that happen from the VAERS database. Are you familiar with the VAERS database? It's the Vaccine Adverse Event database. And you can report that. I can report anything I want. I really, you could, I could report my lung thing and say, I don't know that the vaccine didn't cause that, and it would go into the database. Yeah, Tace.
Okay, so I found it. Anti-vaccination activists online jumped on the news of Hamlin's collapse to blame without evidence.
Well, I mean, we didn't
And
have any
then one
evidence of
account
anything.
promoting a viral anti-COVID vaccination film full of dubious and debunked claims tweeted that prior to 2021, athletes collapsing on the field was not a normal event. This is
It's not
becoming
normal
an
now.
undeniable and an extremely concerning pattern.
Okay, where's the pattern? Am I unaware of other people like this happening?
Then it says anti-vaccine activists have collected a number of anecdotal reports of athlete deaths in order to bolster their claims.
Okay, so I listen. Fine, I think that's great. We should. And what we
Research.
shouldn't do is just say, well, they're a bunch of effing crackpots, even if they may seem that way, because we don't want to shut people up. We did enough of that over the last couple of years. We want to have a discussion about it. If they'll have a discussion, if they won't, then then it's faith based.
It also says, though, that his vaccination status is unknown.
Well, okay. My understanding is that everybody on the team was vaccinated except for 2 people.
Okay.
And those 2 people weren't him. But I don't know if that's true either. But it doesn't matter. Here's the thing. How would we determine whether this is vaccine related? We would want to go back and see if this is unusual. Is there something going on where we actually are seeing more people keeling over on the football field with sudden cardiac arrest than we did before 2019. Okay. And then if you do see a preponderance, then you want to take away all of the different variables that you can. Are more people smoking because of the thing? Are more people eating different things? Are there people's cholesterols? Did they miss appointments because of the pandemic and because of telehealth? Oh, you got to take all that stuff out. And then was there any evidence of myocarditis? If he had tragically passed away, they would have done an autopsy, would have been able to tell that. Thank God that didn't happen. Sure. But, for some of the ones that do pass away, is that, because the thing is myocarditis. That's what you're worried about.
After a vaccine.
After the vaccine, right. But here's the thing. So I got this VAERS data thing sent to me, and it's here's myocarditis, there's cancer, there's all kinds of adverse events that are associated with the vaccine. And then you look at the data. You know what else causes myocarditis? COVID-19 does. And it does it at a higher rate, and it's more severe than when you get the vaccine. So now what some people say is, okay, well, maybe I can avoid getting COVID-19, but if I take the vaccine on purpose, then I'm exposing myself to risk. I understand that. I'm not in favor of mandating this vaccine. I just want us to have a rational discussion about the risk, benefits, and alternatives. Because it is, anything that's emergency, under an emergency authorization, I don't think that should be mandated. At least not with the the lethality of this virus.
Right.
Maybe if we had an Ebola type virus that could be transmitted by speaking to other people, then we might want to mandate an emergency vaccine. But hopefully we'll have something for that before that. But I do want to talk about the science in a rational way, and just showing up a graphic. Look at all the things that happen after the vaccine, and one of them's cancer. And it's like, well, where did that come from? It's just because somebody reported 2 years after I got the vaccine, I also got cancer, and they throw it in there because they have to.
Right.
That's how that thing works. The VAERS database is self-reported, and all it's good for. It's not good for this conversation that people are having. All it is good for is to alert researchers that there may be something, and to go do an actual study, to see a real study, a scientific study. And, this kind of thing happened with, autism, with kids, the MMR vaccines and stuff. And the VAERS database started blowing up with cases of autism that was purportedly related to the MMR vaccine. So they spent the money and did the actual studies, and found that there wasn't a real effect there.
You don't hear about that much anymore.
No. Well, and the thing is it turned out that a lot of it was that they were making the diagnosis more often.
Okay.
And so it seemed like there was an uptick, but if you went back to the original criteria of autism, there probably wasn't any uptick at all, other than just tracking the population growth. So pretty interesting.
Yeah, and I would be interested to see too, and when these things you would have to tease out, other than the vaccine being part of athletes having cardiac events. Supplements, specifically like caffeine. Athletes taking extra caffeine before games to get hyped up or whatever. So there's a lot of other
all kinds of
things.
stuff.
There's all kinds.
You have to control for all these variables. Right. And again, if there is an epidemic of people keeling over like this, then I'm not aware of it. I'm not saying it's not happening, but show me the evidence, because I'm not seeing any numbers that show that there's some sort of concerning uptick in this kind of thing. This kind of thing just sucks when it happens. And, if the sad thing is, if it had been one of the two guys that hadn't been vaccinated, then that would have gotten blamed by the other side. And it's like, it is sad that to have a balanced viewpoint in this world right now, you have to balance two kind of really extreme ways of looking at things. And when really the data will tell us what we want to know. And we've talked about last time that if you go back and listen to that show, that you can use statistics in such a way that you can be right and argue completely opposite things. Because we talked about relative risk versus absolute risk. And the one side can say, if you, I can't remember what was it? We were taking, what was it?
I don't remember.
Hang on a second. I don't want to sound that stupid. Hold on. It was 0.00. What the fuck was that?
It had to be something to do with vaccines, doesn't it? What were we talking about?
Oh, no, it was natural immunity versus, I remember. Okay, hang on.
It's because I already erased last week.
That's okay, yeah. Me too. Hang on. When it comes to natural immunity versus vaccine immunity, people that had vaccines with natural immunity and other people that just had natural immunity alone. And you could say, well, yeah, there was a 33% decrease in, adverse outcomes. And you'd say, oh, well, that's 30%, so you should get the vaccine. But then the anti-vaccine people would say, yeah, but the relative risk was 0.0001 or something, Mm-hmm. So those two things are both true, mm-hmm. and you can argue whichever thing that you believe in. And that's what I don't like about this, the situation that we're in, because we are arguing based on what we believe in rather than believing things after it's demonstrated by the data. But anyway, there you go. It's just called bias, and we have become biased because this whole thing became politicized, because that's just what we do now. Anyway, I'm glad he's doing well as of this recording. He is progressing, and I would expect, barring that there's some neurologic deficit that we are not aware of, that he's going to make a full recovery. Certainly hope so.
They said this morning he's neurologically intact.
Okay, good deal.
Good, yeah.
All right. I have one that's sort of apropos to this. If I say apropos one more time, I don't know why that word's in my head. This is related story. Association between meatless diet and depressive episodes. A cross-sectional analysis of baseline data from the longitudinal study of adult health. And I'm going to give you a clue here in a minute that will tell you what the right answer is, but you won't know it until you look at this. So what they're saying is they looked at 14,000 people aged 35 to 74 years, and they defined a meatless diet as, through this thing called a food frequency questionnaire, which is another validated instrument. Somebody thought that up and got validated the damn thing. And they found a positive association between the prevalence of depressive. What is that noise? You guys keep hearing that?
I just heard it once.
I just heard it once.
I've heard it for the second time. Hold on. There it is again. Something's thumping. I don't know what it is. Okay. And probably got it named after themselves. But anyway, they found a positive association between the prevalence of depressive episodes and a meatless diet. Meat non-consumers experienced approximately twice the frequency of depressive episodes of meat consumers. Now,
duh.
Now, here we go. So this is their conclusion. That was the results. Depressive episodes are more prevalent in individuals who do not eat meat, independently of socioeconomic and lifestyle factors. Nutrient deficiencies do not explain this association because they couldn't find any, at least the ones that they looked for. The nature of the association remains unclear. Longitudinal data are needed to clarify a causal relationship. Okay, so they're saying there's an association, not necessarily causation. Now, what if I told you that this study was done in Brazil? Would that help to explain things for you? What questions would you ask in that situation?
Every time I've been to a Brazilian restaurant, there's one thing on the menu, basically.
What is that one thing?
Different kinds of meat.
Give yourself a bill.
Damn it! Yeah, they
2-1,
they
buddy.
can't go out and eat anywhere. So, one of the questions you might ask is, what is the prevalence of
vegetarianism
in Brazil?
Yeah.
It's like 0.05% of the population. So, to me, that's your answer. These people feel completely overwhelmed by the rest of the
outcasts,
population.
They are
outcasts. Be really interesting if you did this in, say, Norway or even in the United States, if you got this sort of a strong association. So this is most likely cultural, not physiologic. So but I said in my Twitter analysis of this, watch for the clickbait titles because they're coming, and you'll see. Well, vegan diet,
Leads
leads
to
to
depression.
and all this kind of bullshit. So, isn't that interesting?
That's hilarious.
Yeah, and this was done in the Journal of Affective Disorders. So I don't know who these people were, if they're psychologists. I don't see any initials after their name, so it's hard to say. So I don't know. So it was not; these were not nutritionists doing this or anyone.
Oh, I'm sure if they had initials, they'd put them there.
I think you're right. I don't know. None of them had initials, so I don't know. Maybe they just don't put initials in that journal. But, all right. And I have one other news story that's pretty interesting. For those that followed the very early COVID sit reps that I did on YouTube, this is something I've been calling for a very long time. And this is from the New England Journal of Medicine, not some crappy journal from December 28th. VV116 versus Nirmatrelvir ritonavir for oral treatment of COVID-19 is the title. What this is a drug that was compared to Paxlovid. Okay, so Paxlovid is the pill that you can take, or the combination of pills that you can take for COVID-19, and it prevents hospitalization about 90% of the time in people who are at risk.
Okay.
The problem with it is I'm always very hesitant to write it, particularly for people who are on lots of medications, because there are a lot of adverse drug interactions. So then you go, well, we'll use molnupiravir, which is very well tolerated, has very few drug interactions, and it's just one pill instead of a bunch of, or a couple of pills that you have to take concurrently. But the problem with molnupiravir is it only prevents 30% of hospitalizations compared to placebo when given to people at high risk. Now, molnupiravir is a great one if you just want to knock it out quickly and you're not at high risk. If you can get somebody to write it for you, because the symptoms go away pretty quick on that one. But as far as people who are morbidly obese or over 65 or having autoimmune disorders, it's really a 30% reduction in hospitalizations, which we would have taken early on.
Oh, heck yeah.
I was a big proponent of favipiravir, the Fuji drug. I think that one got politicized to death. And when I mean politicized, corporate politicized, because Fuji wasn't a major player in pharmaceutical space.
Gotcha.
But and then all of a sudden, here comes molnupiravir from Pfizer, and it hits the market, and we never heard of favipiravir again. Neither here nor there. Anyway, this VV116 is very well tolerated, better tolerated than the Paxlovid, and with fewer adverse events and fewer drug interactions, and it works just as well. So now we have yet another pill that we can give people, and this one will probably take over just because it's simpler to take, and it is, you don't have to worry about it as much when you write the prescription that someone's going to have a problem with it. Yes.
So it's ready to write? It's been approved?
No, it's phase 3.
Okay.
But phase 3 means that they've tested this on, let me see how many people. It should be tens of thousands of people. Well,
it appears to be pretty safe.
Okay, sorry. Well, in this one, it's a pretty small phase 3 trial, 822 participants. But you know why they could get away with doing such a small phase 3 trial? Because they've already done a huge phase 4 trial, because this stuff is oral remdesivir. So remdesivir was the first drug that came out, if you remember, and we were giving it to people right and left in the ICU, and it was disappointing. I wouldn't say it was an utter failure, but it was definitely disappointing and wasn't the panacea we were hoping for. But what we argued on this show multiple times was that they're giving it to the wrong population. They're giving it to the people when they're at death's door, rather than giving it to people early in the course of the illness to prevent them from progressing that far. Mm-hmm. So some WAGs did a study on IV remdesivir in the outpatient setting in people with mild to moderate disease, which is what I had. That's the stage of disease I had. My oxygen was starting to decline. And they were giving it to them in the outpatient to see if it prevented hospitalization and death. And there you go, 80 to 90%. It was as good as the monoclonal antibodies. but it didn't vanish in effectiveness when the virus mutated. That's the problem. The original Regeneron, which is what I got, is worthless now.
Okay.
You know, against these new strains. But IV early remdesivir still works great. Mm-hmm. And Paxlovid and Molnupiravir all have the same efficacy that they ever did because they're not contingent on that spike protein being a certain way. They work on destroying the life cycle of the virus, which is different. Okay, so
Gotcha.
now, but the problem with IV remdesivir, I tried to get an IV outpatient remdesivir clinic going here when we could see all of a sudden we would buy all these monoclonal antibodies and they just quit working. You've just got thousands of dollars of stocks sitting there, just totally worthless. Let's get an IV remdesivir thing going. Well, the problem with that was they had to come, I think, if I remember correctly, they would have to come twice a day for like 3 to 4 days in a row and get IV infusions. Pain in the ass.
Yeah.
You got thousands and thousands of people with it. It was really hard to do. Yeah. So we're always hoping that an oral version would come out. And now we've got this phase 3 trial that shows that it is just as good as Paxlovid with fewer adverse effects. So I think this is a great drug. I had people say, well, didn't we hear remdesivir was a bust? And it's like, yeah, in the ICU, not so great. But in the outpatient setting, it's the stuff.
Well, so far it looks good, but phase 3 doesn't necessarily mean it's going to get
That is
approved,
correct.
which is why I'm retired at this moment.
That is correct. That is correct. You're absolutely right. It says time to sustain symptom resolution did not differ substantially between the two groups. No participant in either group died or had progression to severe COVID-19 by day 28. And the incidence of adverse events was lower in the VV116 group than in the nirmatrelvir-ritonavir group. So the reason I think that this probably will come out is because remdesivir is already out. And if they show that it's not inferior to Paxlovid, which is all they're looking at on this, that it'll be pretty quick that they'll. But I would like to see a real FDA just approval of this drug. And I'm not advocating that they should do that. I'm saying I would like to see that it goes through all the steps and they're actually able to do a real FDA approval of this. Because if it works for COVID-19, it probably works for the other common colds as well. And wouldn't it be nice if you, finally, instead of going when you have a cold and you go to your primary care and demand an antibiotic, which we know isn't going to do shit, that you could actually demand
an antiviral,
that would be safe and effective, and it would knock the common cold out in a couple of days instead of 2 weeks.
Heck yeah, it'd be wonderful.
It'd be fantastic.
Would.
So I'm really hoping for this one to do something. Anyway, all right, that's all the news I've got. You guys got anything? Well, this is a news episode, I guess. I've got some calls, though. You want?
Let's do calls.
Do you have anything, Tace?
No.
Okay, all right, very good.
Number one thing, don't take advice from some asshole on the radio.
All right, here's a good one for Dr. Scott, actually.
Hi, Dr. Steve, Dr. Scott.
Hey.
Hope y'all are doing great.
Hey, thanks.
How's
man.
it going?
Good, going
Great,
good. How are
great.
you?
Sweet. This is John from Chicago.
All right. Man.
Hey, random, funny, just lighthearted question to Dr. Scott. So, would you be a traditional Chinese medical practitioner? If you're in China, do they just call you normal, or are they like he's a weirdo?
He's still weird. That's what he was going to say. Like you are here. Are you weird there like you are here? Scott would be weird in
I'm
China.
weird
But
anywhere,
if you were a traditional Chinese medicine provider in China, are you considered, people look at you sideways? I know the answer to this. But
Nope.
Yeah, they really don't.
No, they really don't. Yeah.
Do you know the percentage of people that consult traditional Chinese medicine in China?
Nope.
It's about 60%.
Is it? Yeah.
Yeah.
Yeah, I know the Western medicine hospitals over there
It's
are fabulous.
very well established, and but people still will use it and traditional Chinese medicine at the same
Use
time.
the combination. So yes, I'm weird throughout the.
Yeah, he would be
universe.
weird throughout the universe. That's right. Even in parallel universes.
Yes, even in my parallel universe.
I don't
I'm
even
a bit
think there's
odd.
one where like Scott would be normal, and that's hard to do.
That's exactly right.
All right. Let's see.
Hi, Dr. Steve.
Hey.
Dr. Scott, if you're there.
Hey, man.
Casey, hello.
Hello.
Hope y'all are doing wonderful.
Oh,
this
my
is
God.
John from Chicago.
Did you hear how he said that? He's adopting how Stacey
Oh
Deloach said it. Did you
no!
hear
Let's
that?
not start that.
Yeah, please,
no.
guys.
There, Casey, hello. Hope y'all are doing wonderful. This is John from Chicago. Love the show.
the
Thanks for
same
taking
guy.
my questions, putting them on the podcast. Appreciate it.
Yeah, man.
Question about, I guess, drug use. And this is not to condone drug
That's
use,
okay.
and I'm sure
We get it.
y'all would not do that as well. But what's the least, in general, I mean, in your medical opinion, what's the least caustic method that people use to get drugs into their body?
Well, it depends on the drug, but I would say the oral route. If you snort stuff up your nose, long enough. I mean, look at Artie Lang. That's what can happen.
Mm-hmm.
You can lose the cartilage in your nose.
IV.
IVs,
And ultimately, your veins are going to break down.
and you may inject bacteria into your bloodstream, and then, or even worse, fungus and stuff.
Yeah.
So you end up with a fungemia or something. Taking it up the ass is, we've already discussed why that's stupid. You can't control the intake. So when we're going to say drugs, I'm not going to talk about illicit drugs, because there are some that are just caustic on their
Period. Yeah.
on their surface. One of those being crocodile, which is a version of heroin that's made from codeine that's extremely caustic. And when you can't get heroin, people will use it, but it will turn their skin. It causes so much inflammation that it thickens the skin, makes it look like crocodile's skin. That's where it gets its name. But so we'll just talk about alcohol. Alcohol is a drug. So don't put it under your eyelid. Don't snort it up your nose. And don't shove it up your ass. Just drink it. And drink responsibly if you're going to drink. And then that's it, really, to me. Smoking is going to always be more caustic, no matter. In vaping is still, I have issues with turning something into a vapor and taking it into your lungs. Although, done with the proper drug delivery system, we're going to be using inhaled drugs to increase bioavailability and increase onset of action and stuff like that. There may be an inhaled insulin coming down the pike. What we have to determine is, if you're going to do it every day, in and out, in and out, in and out, that's one thing. If you just need to get something into somebody's system quickly, and you don't have time to do an IV,
Right.
there are delivery systems that will allow you, and these are experimental, I still haven't seen them hit the market, to give it to somebody in an inhaled form.
Yeah, even nasal sprays like ketamine.
Well, yeah. Right. Well, that's true. Yes, of course. But so when done properly, that can be something really effective. The question about inhaling medications, even an insulin as a vapor, is, does it cause any inflammation in the lungs? Because what you don't want to do is take it for 20 years and then end up with
Lung cancer.
Yeah, lung cancer or pulmonary fibrosis or something like that. So still taking it orally is going to be the way to go. Anyway, all right. This is a weird question here.
Hey, Dr. Steve, it's Calvin from California.
Hey, Calvin.
I was wondering, they had that recall on Jif peanut butter,
Yep.
and it was recalled for salmonella.
Yes.
What if you boiled the Jif? Do you think it would kill the bacteria, or is
Yeah. Yes. But can you imagine? Well, I've got, instead of taking it back to the store and getting another bottle or whatever jar of Jif, I'm going to boil it. Can you imagine the stink?
one of those
friend of
thermophilic
mine-
ones that would just really dig and get down with being so hot?
Yeah, it's not. Salmonella is not thermally stable. It would kill it. Yes.
A friend of mine had a guy come visit her, and he didn't think that Jif was everywhere, so he brought his own bottle of Jif.
Well, you thought it was local?
He brought his own bottle of Jif in
Oh,
the
my word.
suitcase.
Oh my God!
Oh my word!
And he told her that he did that?
Blessed.
Yeah.
Blessed.
Bless it. Bless it. God,
So-
bless it.
That's odd. Where was he from?
If you think real hard, Steve, you'll get it, but we can't say the
Okay.
name.
All right. after. Okay. Yeah, it's hilarious, and it's one of those things that is just going to have to remain a mystery to our listeners.
But
okay.
yes,
Hey, what's up? Love the show.
Oh, that's okay. Yeah. So, and then his mistake was, I brought my own jar of Jif. Just, if you're going to, and well, he didn't know it was weird.
How bizarre.
I didn't figure you all up pure of peanut butter.
Up here.
We got this stuff called peanut butter where I come from. Okay.
he's ass backwards.
This isn't necessarily a medical question, but you all have a good opinion on things. I want to get your advice
Okay.
from this Epi and Anthony show. Love your show, both of you doctors. But what do you think about House the Water guy? These douchebags. You're swimming in a pool. It could be a guy or girl. House the Water. What the fuck do you think? What the fuck do you think? I'm in the fucking water. It must be fucking terrible if I'm in it, right? House the Water. House the Water. Tell me what you think of these fucking assholes. What would Anthony think about that? Anthony hated the till. What he got, the till. Stop saying till. And one day Jim Norton would say cobbler. And Anthony said, they're going to need a cobbler to get my foot out of
Okay, I know it's his blood. This guy was on a tear. Yeah, I'm not a comedian, and it's been established I'm not a funny person. But that is, just ignore him or say it's wet or one,
Well, it's an interesting point.
Or fuck around and find out or something. What would you say to somebody? How's the water? It is idiotic. What they're saying is the water cold?
Mm-hmm.
Do you perceive the water to be cold? That's how I would ask someone if I wanted to. Just as if...
Then you would sound like a big nerd.
Sure.
Do you
just
perceive the water to be cold?
Well, and that's the thing, is so you go, how's the water? And that's what you're saying. It's like when we went to Star Wars land. At Star Wars, I walked up to the guy, and they were selling these Cokes in these little spherical things. I walked up to him, and I said, how many credits for a sphere of liquid refreshment? What was it? That shit. All right, God damn it. Hang on. I fucked it up. Hold on. And they were selling these spherical bottles of Coke. And I walked up to the guy and I said, how many credits for an orb of liquid refreshment? And he went, that would be 3 credits. Okay, well, now I'm one of those guys. And the kids were like covering their faces and just shaking their head and looking at the ground. Tacey was laughing. I thought it was funny. It was funny. Fuck all y'all.
Those poor boys, those poor children.
All right.
They're rotten.
Yes, they are rotten.
We answered this one.
Hey, I got a question for you. I'm in my mid-40s, and it seems like after I have either intercourse or rub one out, it seems like it takes about a half an hour or so, but it seems like there's almost like it started to get a kind of a burning sensation, almost kind of like
This isn't the same question, but we get this question very frequently.
plug in a way, and then it just gradually gets a little worse, and I have to finally go in and sit on the toilet and kind of push it out, but not a whole lot comes out, but it seems to clear it up. This has happened on and off for 20 years.
Yeah. Yep, and I hate that he's been suffering for 20 years because we had the answer to this on maybe like the 3rd show we ever did back in 2007. Do you guys remember what this is?
No.
Urethral spasm.
Give yourself a
Put it
bill.
on a board, baby.
Yep.
Oh.
Yep.
You know, I've read a lot of shit this show.
Mm-hmm.
I've said a lot of shit this show, and I got one.
You got
Give
one.
yourself a bill.
Damn it, no.
You got a bell for saying you
She
didn't
had
get
one
it.
earlier. That's
All
3-2.
I have to do is bitch about it.
Well, you got a bell for saying you didn't get any bells.
Yeah,
so
she's
that's
she,
correct.
yes.
No, you got one.
She did got one earlier.
No, you got
it's,
2.
It's 3-2.
Anyway,
Damn it.
take your junk
Yeah.
and dip it in warm, not hot water, and this will go away. This is spasm of the urethra, and for whatever reason, just the warmth of the water, but God, not hot water, just warm water. If you have to have a little bowl or a glass or something, you can just dip
Leave it by your bed.
Dip your jungle region in it, and it will completely go away. And it's mostly penis because it's the urethra is the problem. But anyway, all right. Thanks for calling. Go to our website at drsteve.com. Until next time, check your stupid nuts for lumps. Quit smoking. Get off your asses. Get off. Shit. Fuck. Hang on. I got to get that right. Check out our website at drsteve.com for schedules and podcasts. Until next time, check your stupid nuts for lumps. Quit smoking. Get off your asses. Get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. There you go. All right. Phew.
Good.
Was it, though?
I think so.
I did not take my modafinil today, so I felt a little less than today.
You weren't a spastic today. I think that's a good thing. You're more chilled.
Oh, really?
Oh, yeah.
Okay, well, all right. But then I feel dumber, though.
He's not buying it, I don't think.
Mm-mm. Got any questions from the waiting room? I've got a good one for the after part.
Let's do it.
Okay. Because I know this person listens to the podcast.
Oh, cool.
If you want to look up nocturnal arrhythmia. Oh, we've got two. We could do two. We have one on adverse effects of cat litter, too, that I've been wanting to do. We'll do that next Sirius XM show. All right. Colin Carnes has a question.
Yep. I think we already know the answer, don't we?
Yeah, I sure do.
Yeah. Yeah, Colin, it's called neuropathy.
Yep.
Yeah, we'll talk about that.
Yep.
We have time to talk about it?
Yeah, of course. Okay. Whatever you want to talk about.
Yeah, we'll do that one.
Well, I'm just getting set up here.
Little mood music.
You can turn the air on while you're just getting
I sure
set
can.
up.
Thanks for reminding me, Taste. Okay. All right. That's all you get.
It's better than nothing.
Is it?
Yeah.
Okay. Can you feel it?
Mm-hmm.
Oh, yeah.
Can you really? Okay. All right. Here we go. All right, Dr. Scott, you have any questions from the waiting room, or?
Yeah, our old buddy Colin Carnes has a good one.
Okay.
He's talking about his mama, sweet mama, having some hot burning pain in her feet so bad. In fact, she feels like she needs to put them in ice water. She's 66 years old and just was wondering if we had any ideas of what may have caused or maybe some treatments to consider.
Sure. Well, you know the answer to this.
Yeah, it sounds a whole lot like she's got some neuropathy in her feet.
Yeah.
So a neuropathy is just nerve pain, nerve-related pain. It can be caused by a number of things. You want me to run through them real quick?
Yeah.
Yeah, a couple
sure.
things. It could be considered iatrogenic, so it could be secondary to medicines, chemotherapy agents, statin medications, cholesterol medications, and some others can actually cause neuropathies.
Right.
Number one. Number two, diabetes can cause neuropathy in feet. Number three, you can have a thing in your spinal cord called a stenosis. And there's a narrowing of the canal in the stenosis. And if it's on both sides, both feet, typically we'll think it's a stenosis.
Yeah.
If it's just one side or the other, maybe it's something along that chain. Maybe it's still in the back, but maybe
Well, you could have a
somewhere down the
stenosis,
leg.
but a different part of the
Right.
of
And
the
not
bones.
shoot and not shoot down both sides.
Right, that's
Yeah.
right. Well, you can have spinal stenosis, which is the canal.
The middle of the canal, the
and
center
then you
part,
can
yeah.
have foraminal stenosis, which is where foramen is just means hole, basically, where the nerve root passes through.
Yeah,
so
it
you
comes
could-
out
then
of the spine,
Then it'd be
goes
one
into-
side
yeah.
more than the other, or
Right on.
one side solely. So, yeah. So she needs to get that checked out. I would recommend that her primary care see her for that and do a complete evaluation. They could do some neurologic tests just to see if she has hyperalgesia or allodynia, which are signs of a
hypersensitive
nerve
pain,
neuropathic type syndrome, where you do very light touches or something that's minimally painful where it's amplified, or you get pain with very light touch that normally wouldn't cause pain. And then they can also do a test for sensitivity to touch, and they can see if maybe she's lost some sensitivity. And then there's also a test for a thing called proprioception, which is where you lose the ability to determine where joints are pointing and what position and space they're in. And that's all of that information is sent to the brain through nerves. And when the nerves are damaged, it can't get that information anymore.
Yep.
And one of the unfortunate things about neuropathy is if you get primarily numbness in the feet, you can get Charcot feet, where the bones start to break because when you injure your foot, you don't favor it anymore and you just keep injuring it. Or you can get what she's got, which is you get this sort of tingling pain, which we call paresthesia. It feels like pins and needles and stuff. Mine feels like if you imagine a pin cushion, but all the pins the sharp points are sticking out. And then you take that pin cushion and rub it all over the top of my toes. That's what my neuropathy feels like when it's bad. And because of some nutritional supplements, which are on the website at drsteve.com. If you can't find it, let me know, because I'm redesigning it and it's in the middle of it right now. And some links have gotten lost, but let me know and I'll send you some info on some nutritional supplements. You can also go to stuff.drsteve.com and just scroll down. I've got all the nutritional supplements that with some data that, none of it's great data. Nobody's doing, multi-center, double-blind, placebo-controlled studies on these things because they're not going to make any money off of it.
Exactly.
That is one of the issues. I get it with medicine the way it is, when it's being driven by profit. But that also gives us all kinds of great innovations too.
Sure.
So it's a double-edged sword. But there is some data on these things. You can just go there, stuff.drsteve.com, and just look for the bottles of nutritional supplements. And if I remember correctly, I put all the studies there as well. So yeah.
And I was going to say too, the treatments for your mom's foot pain is really going to be dictated by what the underlying cause is. Yeah,
that's right.
If it's a drug, sometimes stopping the drug will make it better. If it's a disease, sometimes a medication for disease. But if they're not for sure, things like sometimes they'll do epidural steroids into the spine.
Yeah,
and it'll calm things down. If it's a stenosis, depending on what it was. Sometimes the acupuncture helps. Sometimes massage. There are a number of things that can help.
Multifaceted approach.
It's pretty
challenging. One of the tests
challenging.
that they could do to see where it's coming from is a thing called an electromyogram with a nerve conduction velocity. No, you
do that last.
Well,
do
yeah,
that last.
do it if they can't figure it out. But
no, I know.
That will tell you if there's a nerve that's being compressed somewhere. It'll tell you if it's a polyneuropathy or a mononeuropathy multiplex, which is a lot of diabetics will get that, where you have a bunch of different single individual nerves that are all being damaged, but they're being damaged separately by the same insult. So anyway, and then let us know what they find, because there's lots of treatments for it too. Duloxetine is the drug of choice for neuropathic pain, and it is also sold as an antidepressant called Cymbalta, and it just has two different effects. They're similar, but they're different, just like aspirin is good for an ankle sprain, but also good to prevent heart attack and stroke. Duloxetine is good for neuropathic pain, but also for depression. So there you go. And then methadone is an opioid that sometimes if you have completely refractory and you can't stand it and nothing has worked, you've tried gabapentin and you've tried pregabalin, you've tried the duloxetine, you've tried everything else, then the very last resort would be methadone. And methadone is the only opioid on the market in the United States that also attacks the root cause of neuropathic pain, and which is the N-methyl D-aspartate receptor. Don't worry about that. There won't be a test afterward, but it will antagonize that receptor, and that is responsible for sending the signals of hyperalgesia to the brain that we've already talked about. All right? You happy? All right. Let's do this one. This is a good one.
Hey, Dr. Steve, Dr. Scott, Casey.
Howdy, howdy.
How are you guys doing?
Good, good. Hey, Lydia got
Good,
her first
great.
shout out. She's not
so
here.
So I've recently got one of these fitness trackers that, also tracks your heart rate, and I've been wearing it to bed. And I've noticed almost every night, not every night, but almost every night, within an hour or two of falling asleep, my heart rate peaks to, 160, which for me is about the same as it is when I'm, at peak cardio. But it's just momentary.
Yeah, he sent me a copy of what his watch is printing out, and he's got a normal sort of hammock-shaped heart rate. It should be higher when you go to bed, then drop, and then raise back up again in the evening. It should look sort of like a hammock.
Gotcha.
And his is doing that, and then right a little past the middle of that sleep cycle, he gets this huge spike up to like 170, and then it comes right back down again.
Okay.
And then it goes right back down to like the low 60s or 50s, which is where it is the rest of the night when I'm sleeping. Listening to your show, I think it might be one of these hypnic jerk episodes.
Yeah, I don't think so.
Which I didn't really know I had. And it's weird that I thought those happen like when you're first falling asleep. And this
They are, which is why I don't think that's what this is.
seems to be around 1 a.m. in the morning, which for me is like 2 hours into sleeping.
Yeah, I'm going to give him a bell, though.
Give yourself a bill!
For knowing that that wasn't probably it.
Just like I said, it's momentary, goes right back down.
Yep.
I don't think it's sleep apnea or anything like that. I feel well rested and awake in the morning, but just never knew. Well, is there anything to be concerned about? Do you think it's one of these hypnic jerk episodes?
Yeah. So you could not have sleep apnea, but still have sleep deranged breathing, And if you do, these kinds of episodes are associated with that. So when you get up into the 170s, you're thinking arrhythmia.
Mm-hmm.
And arrhythmia just being just meaning a rhythm other than a normal rhythm. And it's all on him. It's always self limiting. It happens and it comes right back to normal. They did a sleep heart health study where they looked at people for paroxysmal atrial fibrillation. That means irregular heartbeat and it can have a rapid heart rhythm that just comes and goes.
Okay.
It's not there all the time. And what they found was that these episodes were associated with disordered breathing in the middle of the night. So a couple of things I would want to know is, number one, is this associated with any sleep phase? Because, that watch you have will tell you if you're in REM sleep or if you're in deep sleep when this happens. Also, some of the watches will look at your oxygen level, and that's not very accurate, but it's accurate enough. Is it dropping right when this happens and then your heart rate goes up? Because that could be evidence for sleep deranged breathing or whatever, the SDB. So sleep disordered breathing. So what I wouldn't rely on that, though. What I would do is two things, and the one they could combine into one. You could get a Holter monitor, and a Holter monitor is a thing that you wear, and you would wear. In his case, he would wear it to bed, and it will record 100% of his heart rhythm episodes, or every heartbeat. And it gets like an EKG tracing. And then if it happens, they can say, yeah, this is atrial fibrillation, it's atrial flutter, it is ventricular something, this, that, and the other, supraventricular tachycardia, whatever. And if it needs to be treated, fine. If it doesn't, if it's considered benign and self-limited, then they'll just leave it alone. The way that they could combine all of these things would be to do a sleep study,
okay.
A polysomnogram, and you lay down in the place at night and they put an EKG on you, and they put all kinds of different monitors on you, a spring around your chest to determine when you're breathing and when you're not breathing. And they monitor you every which way, up and down, even an EEG they can do. And you sleep, and you hope that one of these things happens while they're watching you, and then they can determine what it is. The big thing that increases the odds, of course, is the frequency of this. If you're noticing this every single night, then the odds are they'll be able to catch it doing one of those two things. Okay?
Right on.
So that's what I would do. All right. But I wouldn't dick around with it. You seem fine.
Mm-hmm.
There are some weird conditions that can cause nocturnal arrhythmias that aren't fine, but if you catch it now, they can take care of it. It's treatable with medication.
Cool.
So just go get it checked out, and then let us know what they find, okay?
Cool.
All right. Got anything else?
I believe I'll do her.
Tacey?
Nope.
Well, all right. Well, maybe I do have something.
No, you better not.
No,
Thanks.
It's jam time, baby.
Is it? We go jam a little bit at the
Yeah,
end?
we'll play something.
For people who don't know what we're talking about, if you hang out with us in the YouTube, you get
If
to...
you're lucky enough.
Yeah, you get to be tortured by us doing music afterward. And rather than learning songs and then playing them for our audience after we've figured out how to play them, what we do instead is we learn them while people are watching us, and then we practice them and then play them well for each other. It's the stupidest, most ass-backward thing. It's idiotic.
Yes, it is.
So we should probably do a concert for them at some point so they'll understand that we actually do know how to play some songs okay.
Yes.
But what we're going to be doing today, Tayson, you may not want to go downstairs, is we're going to be doing...
I'm good.
We're going to be learning Bo Daddy Harris's...
Oh, no. That's good.
Queen of My Heart.
Oh, yeah.
Yeah. And so I spent an evening figuring out the structure of this song, transcribing it, and the longest thing was trying to figure out what the words were. And then I asked him, he said, well, just Google it. So I Googled it, and there's a place where the lyrics are after 2 hours of trying to listen to this.
Steve,
Well, they're
you
not
didn't know
right.
that?
Yes, but they're not
They're
right.
inaccurate, yeah.
No,
they're not
wrong.
right?
And
They're wrong, too?
He put them up there, I think, and they're not right.
Oh, my Lord.
I'm telling you, if there was any market for a show where you would go through a Bo Daddy Harris video and compare it to the lyrics that he put up there, I would, by God, do it because it'd be hilarious, but it's not right. Anyway, Bo Daddy. I love him. We love him. So that's what we're going to do. Anyway, so we're going to do that. And if we get anything, if you want to actually see me do this live, come to Dabble. I guess that's what it's called. I don't know what it's called. The event in Rochester, February 3rd. There's going to be a comedy event. There's going to be live podcasts done, and there's going to be an award ceremony. February 3rd through the 5th, go to WATPlive.com. We're going to have a table and some merchandise there, and we'll just say howdy do, and, heck, I'll buy you a beer or whatever if you come say hello.
You better not.
Why?
You can't be buying everybody beer.
Why can't I not?
Because
Do you know how many I bought last time when I said that?
Oh, I don't even want to know.
It was like 6. It was no big deal.
Okay,
Just,
all right.
That'd be like one night. That'd be like one night out with me.
Yeah, there you go.
There you go. See, he saves money.
Okay.
He's not taking me.
It's fine.
Mm-hmm.
It's fine.
It's fine.
And Tacey's all worried because she's not working that we don't have any money, and it's like I can buy a couple of people some beers if they. Most people won't come up and and even say hello. I had one guy that said I was too nervous to come talk to you, and it's like, oh, come on, it's me. It's not. I mean, I don't even be too I wasn't too nervous to go talk to Harlan Ellison or Ray Bradbury at Dragon Con, and those were two of my true heroes, and they're true heroes to a lot of people. Absolutely don't be nervous. Come and talk to my dumb ass. So, Sean and Amanda will tell you. All right. Anything else? That it?
That's it.
All right. Thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM Channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's Pleasure. Oh, by the way, get tickets at WATPlive.com. I'm a dumbass. I'm the worst plugger that ever lived. Right, Tace? Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. And don't forget Dr. Scott's website at simplyherbals.net. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye,
All right,
everyone.
You're not done because we got to do. Well, you can be done. I get. No, you can't. We'll just do the opening real quick and we'll get in and out. Okay, ready?
What's the best place in the house to hide from ghosts? The living room. Excuse me, waiter. This coffee tastes like mud. Yes, sir. It's fresh ground. Which Jedi always got his brother's hand-me-downs? Obi-Wan Kenobi.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve, with my little pal Dr. Scott, the traditional Chinese medical practitioner who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to a regular medical provider, can't find an answer anywhere else, give us a call. 347-766-4323. That's 347. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking over with your healthcare provider. Don't forget stuff.drsteve.com. That's stuff.drsteve.com for all of your Amazon needs. Scroll down, see all the stuff that we talk about on the show, or you can just click through to Amazon. It really makes a huge difference. And then tweakedaudio.com, offer code FLUID for the best earbuds for the price. And with offer code FLUID, you get 33% off. They got great customer service. And Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Check Tacey and I out at patreon.com/weirdmedicine. Tomorrow we'll be recording the Gino Bisconti interview, where he's going to apparently try to convince me that all of this COVID stuff is a conspiracy. So that'll be interesting. And we're going to try to talk science with Gino. And he just doesn't want people to call him a wackadoo, and that's fine. We can do that as long as we can discuss the pros and cons of the scientific method. And then if you want me to say fluid to your mama, give me a shout at cameo.com/weirdmedicine. You know, I used to work at WRAL TV in Raleigh, North Carolina. We did a show called Mid-Atlantic Championship Wrestling, and we had Wahoo McDaniel and Ric Flair and Who else did we have? We had Greg Valentine, Mr. Wrestling Tim Woods, Ricky Steamboat, but we also had a guy named Baron von Raschke. Baron von Raschke, and he had a finishing move called the Claw, and he would put his hands over your head like that, and it was called the Claw, and then you would go out. And it was an illegal move, but the ref was never watching, all that stuff. So Baron von Raschke was hilarious, and he was Mighty Igor Polish Prince's partner, and we've talked about that before. And I got for Christmas, I got Vinnie Paulino a cameo from Baron von Raschke, and he was delighted. He's 1,000 years old.
Looks like he's still around.
Looks like a real skinny Tor Johnson now, but he did a great cameo. Matter of fact, I guess since I mentioned it, I should probably play it, shouldn't I? Oh, is that bad?
No.
Okay, here we go. Okay, hang on. You can go.
See you, Tace. You done good, sis.
Goodbye, everyone.
You done good. You should get
yeah, please do. We're not recording now. I'm going to play.
No, leave it mic on. I'll use it in a minute.
Okay.
I'm going to see if I can find the cameo.
You deserve a bill just for sticking it around long enough.
My ears are killing me.
I know I have better things for you than that. Let's see. Okay, I think what I have to do is I have to log into mine, but I do want to play this on here. It's so great. Okay, hang on. Hello, everyone. We're not recording right now, so I'm not that terrible at doing this. I think the delay on YouTube is insane because we're just now starting the
podcast?
Podcast.
Oh, wow. That's not normal, though.
Okay, so I'm going to say 5, 4, 3, 2, 1, and I want everyone to tell me what the delay is. So 5, 4, 3, 2, 1, mark. Okay. So let me know how much difference there was there. Let's see. So I made butter last night.
Did you?
Yeah.
Medicated butter?
No, just butter.
Oh.
I churned it my damn self. Tacey wanted to watch Emily in Paris, and it's like, okay, well, I'm going to churn butter while you're doing that.
Yes, exactly. You have to let me have some of it. I'll make you some herb butter.
Oh, no, it was great.
No, that's what I'm saying. I'll make it better.
Oh, you mean, herb butter. No, I don't, Dr.
Herb.
Scott, I don't do such things. Okay, let's see here. Let me go to my orders. Okay, here it is. All right, you ready?
Yep.
Okay, here we go.
No, it's not Santa Claus. It's not George.
Okay, so Baron von Raschke is got a Santa hat on and a Santa scarf.
Clooney dressed up to look like Santa Claus. No, this is Baron von Raschke. That's right, the Claw, not Santa Claus. The Claw. And Dr. Steve wanted me to tell one of his best friends, Vinny the Bear Paulino. I wrestled a bear one time. Well, many times actually. His name was Ted. I don't know his last name. But anyway, back in those days, I was in shape. I could go anywhere, I could do anything, and I could wrestle anybody. And I'll tell you something, Dr. Steve has asked me to give you my workout program. Well, I got up early. I went out for a run. I went back, ate a good hearty breakfast.
And well, this is just, I said, Vinny's fat. Can you help him with his workout program?
Then I started to do push-ups. I did sit-ups, good for the abs. Do the sit-ups, maybe push a little weight for the pecs. And that is just the start. And then you go out and you maybe take a long walk. But there are a lot of ways to get in shape. It's gotta suit you. So, Vinny,
it's actually really good advice.
The Bear Paulino, those are my words of advice. Sage words from the claw. And that is all the people need to know. Ha ha ha. Jingly bells, jingle all.
Okay, all right. Thanks, Baron.
That's funny.
You get the idea. All right. Are you ready?
He sounds like a hoot.
All right. Ooh, I hear some Allman Brothers going on over there. You've been practicing? You cannot practice. It'll make me look bad.
No, I've not been practicing.
Okay, did you at all practice Queen of My Heart?
You didn't send it to me.
Yeah, I did. Did I not? Oh, okay. Well, all right. I guess we're going to do it next time then.
We'll try it.
I'll get a copyright strike if I play it on here because he's very litigious, this guy. I tried to get the karaoke version from him, and he said, yeah, you can have a karaoke version, $1,200.
Sounds expensive.
Yeah, a little bit. Hang on. Here you go. There's your
You sent to me.
changes.
You sent to me?
Yep. All right. So,
I need mandolin or guitar?
huh?
I need mandolin or guitar.
No, it doesn't matter.
We can butcher it either way.
Yeah.
Hotmail or Gmail?
Gmail or the scooter.
Gotcha.
So it's in the key of G, and the structure is intro, verse, chorus, alternate verse, chorus, bridge, half of a verse, and then chorus times 6. So it's and I've got it by the chord number, so it's so we can change keys if we need to, but it's key of G.
Okay.
So a 1 would be the G, right?
Oh, for fuck's sakes! You wrote this in a 1, 4,
Yeah.
5.
Yeah. Well, you know what they are. So 3 minor.
What? You're gonna make me do math, you turd.
No. So look.
So 1 is gonna be G, 1,
and then
A, B,
B
C,
minor,
G.
and then the 4 minor. Okay.
So we're going G,
I mean
C, D.
6 minor.
We're going G, C, D.
No, the 6 minor would be okay. So G. So D is the 5th, right? So E would be the 6th, so that's a minor.
Oh, for fuck's sakes! Where's it says A, B, C, D?
Well, I'm telling it to you right now.
Oh, goddamn!
All right. So G, B minor, E minor, C. That's the whole thing.
G,
except
B minor,
for the bridge.
B minor,
G, B minor,
C.
No, E minor, C. That's the 4.
Okay.
Now let me play. I'm just gonna play a little bit for you. Okay.
Okay.
Not enough to get a strike.
Gotcha.
I'll cut it out after it's all over. Let me see. Where are you, Bo Daddy? There he is. Okay, here, listen. That's the rhythm. Okay. There you go. Okay. Now, when you play the chorus,
okay,
it's the same chords just played twice, half as amount of time. So it's hang on. I gotta. You're the girl I'm looking for. Queen of my heart. Okay, so it's the same. Now, lest people who don't know think that I'm the worst singer, listen to him. To make a true love tea. All right, so I'm just doing what he's doing. And let me go get my words. Hang on. Now it does it twice. There you are with your favorite dress on. The sweetest thing I ever seen this far. Reminds me of all those days. Let's go now, we can talk on the way. Volume on the radio is low. Driving down the interstate. And now here's the chorus. You're the one I've been looking for. On the time on the Lee Road. Queen of my heart. The one that won't tear mine apart. She says by me. Okay, now it goes back to the
back to the 4.
And I'm having a hard time.
It's
singing it and
rhythm.
Doing the
I'll do the
bass at
rhythm.
same
I'll do the
time.
rhythm. You just do a heavy note there.
Okay.
I'll just do the rhythm for you.
All right.
Yeah.
All right. Okay. So anyway, so let's do the chorus into the second verse.
Okay.
Okay. You ready?
Yep.
Now this one is weird because it does that alternate verse. The third half of that is the alternate verse.
Okay.
And so let's play the alternate verse real quick. Okay. And it's just one time through. It's just. Yep, that was right.
Okay.
Yep. Okay.
And then after this, and then okay.
Because it goes. Let me just play that one. Make sure I've got that right. It's right here. Hang on.
You talking about?
You sure look good. It's right. Queen of my heart. Looking for the man while we were
watching the moonlight.
There it is. There it
It
was.
so is a random pick that made your eyes gaze into mine. While we were watching the moonlight, you're the one I've
So
been looking
that one's
for.
different.
Yeah.
It goes to the 5 at the end.
D.
Okay.
That's a D.
Yep. All right. And I really should get a rhythm section going too. I had one on here. Well, that's okay. Oh, we'll do that for next time. Okay, you ready?
Mm-hmm.
So let's do the first chorus going into that second verse. And that does the 2.5 times through. Okay, ready?
Yep.
Okay. 2, 3, 4. You're the one I've been looking for, and the only time the lead road, queen of my heart, one that won't tear mine apart. She says by me to make true love a tea, everything be right. In the moon is a way to be with you. Let's go out on a cruise, whichever way it wants to. While South Trap bang in the background, the guitar band was found on train number 6. Sure is. Are you gonna play? It's a random pick. Then make your eyes gaze into mine while we were watching in the moonlight. Are you the one I've been looking for? And the only time on the lead road, queen of my heart, the one that won't tear mine apart. And now it goes to D. And then A minor.
I don't see that on here.
That's, yeah, you do. It's the bridge. It's 5 and 2 minor.
Gotcha.
It's the very bottom.
Gotcha.
Okay.
Yeah.
Okay, ready? 2, 3. Let's do the chorus, and then we'll go to the bridge.
Gotcha.
And it's just D and A minor, and it does that. That's right. That's right. It's right. And then it goes to, you sure look good 24/7. You sure are a gift from heaven. You're the one I've been looking for. See, if you're going to do the rhythm, I need you doing the rhythm because I'm getting lost in the rhythm.
Okay.
Okay?
Wait, so you tell me what you want me to do. I'll do whatever.
Well, I want, like you said, you play the rhythm, and
Okay.
I'm just going to play, the bass note, okay?
Okay.
All right, you ready?
I think so.
Okay, we're going to start it from again. I'll tell you bridge.
I'm reading Roman numerals. I'll do my best.
Yeah, okay. Well, you're learning a new skill. All right. And I can sing this better when I'm not playing at the same time because I never
Tell
could
me
do
about it. Hell.
Yeah, I know. Well, you're good at it. I'm not.
Jeez.
All right, you ready?
Yep.
Okay, 2, 3, 4. You know what? I didn't have your mic up. That might have had something to do with it. Okay. And if you. There you are, with your favorite dress on, the sweetest thing that I've ever seen this far. Reminds me of all those days. Let's go now, we can talk on the way.
volume on the radio is on low, driving down the interstate. You're the one I've been looking for, on the only time on the Ely Road. Queen of my heart, the one that won't tear mine apart. She says by me to make true love a team. Everything be right in the sea, in the moon. Let's go out on a cruise, whichever way it wants to. While the South rap bang in the background, the guitar band was found. On train number, this is the half verse, train number 6, it sure is a random pick. Then make your eyes gaze into mine while we were watching the moonlight. Maybe the one I've been looking for, and the only time on the Lee Road. Queen of my heart, one that won't tear mine apart. Bridge. That's right. That's right. That's right. You sure. Now it goes back. Now it goes back to the G. Back to the verse. You sure look good, 24/7. You sure are a gift from heaven. You're the one I've been looking for. That's my brother on the Lee Road. Queen of my heart, the one that won't tear mine apart. It's right, you are the queen of my heart. Found you ever on this time, on the lonely road. It's right, it's right.
There you go.
Some Bo Daddy Harris.
Bingo.
Okay, so you got the structure of it?
For the most part.
All right, because we're going to need to record it. We got to record a...
a little lost there for a second.
Yeah, it's all right. I can tell, but that's all right. It's the first time through. We got to record that as a karaoke so I can do it. And then I'll have my Bo Daddy Harris voice down by
See ya, Kush.
See, we finally chased
Of all the
Kush
damn
off.
people, Kush left. Of all the damn people that leave Kush.
Listen, y'all go to Bo Daddy Harris's YouTube channel and support him. He's awesome. He does soul music, he does rap music, and he does country music. All right, now what do you want to play for real?
Poor Mitchell listens to this part every week. When's the last time we played that song?
What do you want to play?
I don't remember playing it.
I was hoping you were just going to start picking up, but you were typing over
No, I was actually looking for the. You playing it in B minor?
No, I'll play whatever. We don't have to play that. That's not a real good song for.
Yeah.
Bass and mandolin.
Bass and mandolin. Let's see. Let's play. Yeah, big finish there for sure.
Yeah.
Big finish for sure there, Sean. Somebody said earlier, was it Hickey or was it?
Well, I sent you something that a song that Lovett sent to us. Is she in there today?
Yeah, Lovett's here. Yep.
Is she?
Which one do you recall?
I know you said let's do it this week, and I was like, yeah.
Oh, was it Rocket Man?
Oh yeah, it was Rocket Man. You want to do that version?
Hang on. Yeah, I don't know if that's a key.
We'll do it in whatever key you want to do it in.
Hang on.
We know the song, so
yeah.
just do the Elton John version. We'll just play it.
Yeah, the Elton John version. But instead of being E minor, try transposing it 2 times to like F sharp minor 7.
Really, F sharp?
Well, she packed her bags last night. Pre-flight. 0 hour, 9 a.m.
Hang on, that's too high.
I'm gonna be high as a kite by then.
Try this one. Try D. Try it. Drop it down to D minor.
Sure. D minor, yeah, hang
on. Then it's just D minor 7 and then G.
She packed my bags last night pre-flight. 0 hour, 9 a.m. Oh, what's an A? Ooh.
Oh, it's got A sharp in it, but you
hang on. Let me see if I can find it. Hang on 1 second.
Maybe we should work on this one. Let's try. Yeah, I don't like that F and A sharp for you. Let's find 2 where the chorus makes more sense. How about E and A though? Ooh, now that's not so bad. And you know the F sharp.
Yeah, where are you? You're looking at the chorus E?
Yeah, E and A.
C, D.
It's gonna be a long, long time.
Okay.
Touchdown, bring me back to fine.
And I think it's gonna be a long, long time till touchdown brings you to get to fine. I'm not the man I think I am at all. Oh no, no, no. I'm a rockin' man. Rockin' man, burning out the fuse up here alone. And I think it's gonna be a long, long time. How's it kick off? That might be it. C sharp.
But then it's, you know, the.
She packed my bags last night.
That's an F sharp.
She packed my bags last night pre-flight.
That's F sharp.
There you go. Packed my bags last night pre-flight. 0 hour 9 a.m. And I'm gonna be high as a kite by then. Oh, here we go. Okay. Here we go. Here.
Okay.
She packed my bags last night pre-flight. 0 hour 9 a.m. And I'm gonna be high as a kite by then. Yikes!
Because we need to be able to play it like.
Where's mine? That's some crazy chords, doesn't it?
Well, it's because it changes. It's a typical Elton John. He changes keys between the verse and the chorus. That's what the problem is.
Yeah. Well, we can do it. It was just that C sharp minor 7. Hang on, give me one second. Okay, hang on. 2. 6. Sorry, it's just
Well,
a
why don't we
bizarre,
work on this one? Let's.
She packed her bags as not pre-flight. Yeah, let's do this some other time.
Yeah.
Let's do something we can actually. All right, last song, and we won't torture anybody else. We can do that one. I think we can.
Yeah, we just gotta.
I've just got to find those the keys on them.
I'll play it with the music. Too.
Yeah.
It helps.
Yeah, it's Iron Horse version. That's exactly right. Love it.
Yep.
Yeah, we can do it. It's just a matter of me finding the key to get.
We should get a banjo player up
somewhat
here
close.
and a fiddler and something, and really do some mountain music versions of alt rock and regular pop songs like we've been talking about doing.
Oh yeah. Yeah, let's do a how about some I meant to come up with a good song to get the New Year's kicked off.
Yeah, that's fine. Just pick something that we know and we'll just do it.
Okay, that's cool. Let's do this. You want to do
This is
I
worse
Fall
than
to Pieces?
usual.
I Fall to
Sure.
Pieces. Let's do it. Get me a little bit of volume.
Volume?
Yeah.
For what?
Give me a little bit on the guitar.
Oh, you can play the Git box?
I think so. There you go. That sounds good.
I think I'm a little out of tune though. Hang on. No, it's you.
I fall to pieces each time I see you again. I fall to pieces. How can I just be your friend? Will you act like we've never kissed? You want me to forget, pretend we've never met. And I've tried, but I haven't yet. You walk by and I fall to pieces. I fall to pieces each time someone speaks your name. I fall to pieces. Time only adds to the flame. Well, you asked me to find someone else to love, someone who loved me the way that you used to do. But each time I go out with somebody new, you walk by and I fall to pieces. You walk by and I fall to kisses. There you go.
All right.
We better stop there.
Yep. Quit while we're ahead.
Lord. Hey, at least that was almost in time. It wasn't out of tune, but it was in time.
Yeah. All right. Thanks, everybody.
Thank you, guys.
We're going to get some Bo Daddy done, and we're going to play that freaking Rocket Man if it kills me.
We are going to get. We will.
That's the
get
first time I
Rocket
looked
Man
at it. I didn't realize that he
Yeah.
changed keys like that. It sounded so simple when Iron Horse did it. All right. Thanks, everybody.
Thanks, guys. See ya. Oh.
You all right?
Oh, yeah, I was going to say, hit that air conditioner.